Hi everyone, this is Neil from SingleBestAnswer.com. We are your online revision resource for the UK MLA exam or the PLAB exam. We have built our entire question bank on the GMC curriculum, so head over to SingleBestAnswer.com and check it out. We're going to take a question today from the world of gastroenterology. It should be fairly straightforward for most of you, but we're going to go through it anyway and answer the question as we see it. So we have a 53-year-old woman who has progressive abdominal cramps, loose bowel motions for the last week. Occasionally she reports blood and mucus mixed in with the stool, and she's noticed similar episodes in the past with some intermittent fevers. So our first thoughts are that she's got episodes of bloody diarrhea with fever. This sounds like it could be inflammation. It's quite a short history for a week, so infection could be a possibility, but the fact that it's recurrent means that there's something chronic going on, and we're going to think about inflammatory bowel disease. So inflammatory bowel disease, the main types are of course Crohn's disease and ulcerative colitis. This patient has purely lower GI manifestations. If you're thinking of Crohn's disease, you might expect to see aphthous ulceration, for example, or maybe some small bowel involvements. There are no clues here to suggest that, so we're going to lean towards ulcerative colitis purely because of that. In terms of the fevers, that can occur with any inflammatory condition, so it's not specific. I don't want you to think automatically it must be an infection due to fevers. It could be something like a chronic inflammatory condition such as colitis. So we're going to go with E, which is ulcerative colitis. So we're going to go through the other options just to make sure there's no better answer. Option A, Clostridium difficile. Well, we tend to see that in older patients who perhaps have had a course of broad spectrum antibiotics. There's no history of that here. The patient doesn't have any risk factors for C. diff, so this makes it unlikely. Option B is Crohn's disease, which is our main differential diagnosis. There's no clue as to any involvement of upper GI or even small bowel here, so we're going to lean towards ulcerative colitis. C, diverticulitis, tends to occur in older patients. History of constipation. You can get fevers if there is a diverticular abscess or a diverticular perforation, of course. No history to suggest that here. D, rectal cancer. You certainly should be suspicious if there is blood mixed in with the stool and a change in bowel habit. Anyone over the age of 50. So this would certainly warrant further investigation. But the fact that we've got discrete episodes occurring with fevers, which you can of course get in cancer, makes us lean more towards E, which is ulcerative colitis. And if we select option E, we'll find it's the correct answer. I hope you found that useful. Head over to SingleBestAnswer.com for more of those, or subscribe to our YouTube channel. Good luck in your exams and take care until next time.